Okay, so these activities are a little bit more traditional and things you've probably seen in the clinic already, but I still enjoy using them, and I think they have a place for hand treatment. So let's talk about the finger walking scarf first. This is just something that we're going to sit with at the table with the patient, lay it out all the way across, and then your patients are going to stabilize their palm, and they're going to walk the scarf all the way up until they have gathered as much as they can gather. And then keeping this here, they're going to push the scarf all the way out. Now, another way that you can vary this is you can put one of your palms in the scarf and push it out, hold it here, and walk it back. Okay? You can also do that with two at a time if you want. Another thing you can do is use all of your palms as a really soft activity for grasp, so they can work on gentle grasp and release and grasp and release. Another thing that you can do with a scarf, my table here is kind of short, but you can always use your scarf for rolling out and pulling back on the table, stretching out and pulling back. This also has polyurethane on it, so it's not exactly the most slick surface. But that's one thing you can do with the scarf. Now, you know, traditionally there's all different kinds of palms you can get, but you can use, a tripod, an individual, a lateral, any kind of pinch that you want. But these are definitely for people that are first starting out and just really getting used to manipulating and doing some touch activities. So the palms are very gentle and very easy on the hand to use. So I love them. And you know, people say, well, what about COVID? Well, you know, we have our skin for a reason. And so when we're working with things like cloth, I usually have the patients just cleanse their hands. And I never have patients that have any open areas work with things like this. But they can always wash before and after. And then the next activity is these little blocks that you're going to use for ab and adduction. And so they have a little weight. So I've put a little button on top of each one. And then basically I'm going to pick up and put here. Pinch however you want. Slide in between. Slide in between. You can vary the activity however you want, but these will help your patients to work on ab and adduction. So that's this kit. It's some, you know, rudimentary activities that we've done in therapy for a while, but a lot of fun and a great beginning set of activities for your patient in the hand clinic. And I really think that they will enjoy it because it's a challenge that they can meet. So I hope you find a place for this in your clinic, and I wish you the best.